From what I understand about Kegels, apparently it's meant to make you quote unquote tighter.
It is making your pelvic floor stronger. So when he gets in there, you can suck him back in, right? Do not allow someone else to dismiss your pain. Your experiences are valid and they deserve to be heard. If someone else is deciding to dismiss you, then you find someone else.
Welcome to Spark the Convo, presented by Spark United, where we are empowering women with the knowledge, resources, and community for a healthier and stronger future. I'm your host, Meline Rose, and today we're joined by a very special guest, Dr. Hope. Dr. Hope is a doctor of physical therapy with a master's in applied physiology from Columbia University, specializing in pelvic floor and sexual wellness. Where many pelvic floor therapists go straight to the muscles, Dr. Hope says that that's the wrong place to start. She starts with the nervous system, and that approach is changing how women heal. Welcome to Spark the Convo, Dr. Hope.
Thank you. Thank you for having me, and thank you for that amazing introduction. I appreciate it.
Absolutely. I mean, it's all you. It's all the work that you've done.
Thank you.
Yeah. So I want to start off with the beginning. So how did you end up in pelvic health? What was that moment where you decided to get into this field?
So it wasn't really a straight line for me. So I was in technology for quite some time, but I was always that friend that people came to, and all of my girlfriends would ask me when they had problems down there, or if they had questions about sex or anything like that, because they knew I was always researching and always talking about it and always reading.
Okay.
I ultimately wanted to be Dr. Ruth when I was coming up.
Oh, okay.
So I went back to school. I got my, like as you said earlier, I got my master's in applied physiology, and then went on to get my doctorate in physical therapy.
Nice.
So it's always been there for me. Tech was great, but it wasn't my path ultimately. There was a higher calling for me, and it was ultimately medicine. So pelvic floor ended up being it for me.
Nice.
Yeah.
So I'm curious because as someone who's always researching myself, just researching a whole bunch of topics at a time, I wonder for you, what was it about, I guess, women's anatomy that interested you to the point that you researched about it and your friends would actually come to you?
Yeah,
that
so
sort.
I lived in a very open household, right?
Okay.
So my mom, my mother didn't really shy away from talking about those things. She wanted me to know not only what reproduction was, that's not how she said it, but she wanted me to know how not to get pregnant, how pregnancy happened, but more importantly, she wanted me to know about my own body. So she was like really my first advocate in pushing me towards being okay with my body and reading more and asking questions. Her favorite thing to say was, well, the worst they can say is no if they don't decide they don't want to tell you. So when Dr. Ruth was on, she would always call me down and I would watch it. And that just sparked even more curiosity for me. And I ended up really loving it. So yeah, it was just a natural path for me. And then I always end up talking about it. So when I finally went into pelvic health, a lot of my friends said, oh man, what you're doing is like so you.
So you.
Yeah, like this is so you. So yeah.
That's good. That's how alignment happens.
Yeah.
So a lot of women, even myself, we've heard about the term pelvic floor, but many of us don't even know what it means exactly. So do you mind explaining to us what the pelvic floor is?
Yeah, so your pelvic floor is like a hammock, right? Sits between your pubic bone and your tailbone.
Okay.
And it holds up your bladder, your uterus, and your rectum.
Okay.
If you're a male, you would take away the uterus, obviously, and it would be holding up your prostate. Yeah, so your pelvic floor is huge as it relates to your sexual experience. So when you're having that extraordinary orgasm, it has everything to do with your pelvic floor. So your orgasm can only be as heightened and as strong as your pelvic floor is. So if you have a weaker pelvic floor, you will not have as strong of an orgasm. Now, most women don't realize that, and even most men, because your orgasmic experience is your own experience. You have nothing to compare it to. But when you start working on your pelvic floor, and you start realizing the power of your pelvic floor, and you start having those ear to toe orgasms, as I like to say, and then you really realize that contract and relax, which is the job of the pelvic floor, how much it plays a part in your own pleasure.
Now I'm understanding the purpose of it and how it relates to the work that you do, because you help women who are having painful sexual experiences, and oftentimes that's due to dysfunction in the pelvic floor?
In some cases, right?
Okay.
Not all cases. And so I lead with your nervous system. And so a lot of practitioners, especially pelvic floor practitioners, are leading with strengthening. You hear a lot about it on social media. Strengthen your pelvic floor, do Kegels, do this, do that. But the reality is, it does not matter how many Kegels you do if your nervous system is not regulated. If you have a past trauma or you're stressed, your nervous system is still not going to allow you to be able to have an orgasm or even to be able to engage in intimacy. Because when you try, it's going to be painful because your pelvic floor muscles are going to tighten up. They're going to say, no, not today. I like to use the metaphor of a bear chasing you. If a bear is chasing you, you're not interested in having an orgasm. Because you're like, no, I got to get the hell away from this bear, right? So if your body is always in that heightened state where that bear is constantly chasing you and your nervous system is on high, you're not going to be able to engage in intimacy. You could also experience low back pain, though a lot of people don't realize that. Low back pain, leaking, incontinence as it's called. Those are all signs of pelvic floor dysfunction, but they're just signs. They're not the root. They are just a signal. So women that are experiencing leaking and painful intimacy, those are like the flares of the signal to say, hey, something else is wrong. The pelvic floor is where we have to look, but is not where we should ultimately start when someone comes to me.
You mentioned that you don't fix the symptoms, you fix the root of the symptoms. Give me an example of a root cause of issues with the pelvic floor.
Yeah, so if someone comes to me and they're having pelvic pain or painful intimacy, which I want to bring up, 1 in 5 women do have pelvic pain or painful intimacy. And majority of women are not mentioning it to their primary care practitioners. In some cases, because their pain is being dismissed, or they're simply being told to drink more wine or maybe try to relax.
Do your Kegels.
Or do your Kegels, right? And that's not always the best answer. So when someone does come to me, the first thing that I do is I listen. I need to understand what's happening in your body. You need to understand what your life experiences are, what your trauma is. And then I begin to look at your pelvic floor, but not until I understand what's going on in your body, because I cannot out-exercise your nervous system.
I love that. I cannot out-exercise your nervous system.
Yeah, I can't. It does not matter. I can give you all the pelvic floor exercises in the world, but if your nervous system is still dysregulated and we haven't gotten to the root of what's causing that dysregulation, it does not matter. Yeah. And so that's why a lot of times when women come to me, they've seen other practitioners and they're almost slightly in disbelief that them working with me is going to actually give them some relief. And the difference is because I'm not just handing you a generic form of exercises. I'm actually listening to you, your story, and understanding what's happening in your body, because your life experiences and your stress and your trauma do matter. And it plays a huge part in your pelvic floor. A lot of us hold tension and stress in our pelvic floor, and we don't realize it. And sometimes it presents itself as low back pain before it does anything else.
Why do you think a lot of women shy away from talking about it to people whom they're supposed to trust, whether that's their partners or whether that's their primary care physicians? Why do you think women who are experiencing pain during intimacy shy away from having the conversation?
So it's really a systemic issue, right? And so when you go to your practitioner and you tell your practitioner, I have a problem, I'm having pelvic pain, I'm not able to engage in sex with my partner, and you're dismissed, whether it be verbally dismissed, being ignored, or you're told to drink more wine or do more Kegels or maybe try to relax more, it gets to a point where when you go to any practitioner, you don't mention it. And so that's not a person problem, that's a systemic problem, because now as women, we've learned to not say anything because it's going to be dismissed either way. Another reason is because in the world that we live in social media, even in social media, women's health matters are censored well before men's are. Even as a health practitioner, I can be censored for saying vagina on Instagram when we can talk about male erections and there's never any censorship for it at all. We as women are being told that our issues do not matter as much as males do because ours are consistently being censored.
Yeah, that's good. And there's also like a lot of shame as well around women aren't taught to be empowered in their in their sexual lives, you know?
Well, yeah, and so some of that goes back to being dismissed, right?
Yeah.
Not just with your primary care provider, but even in the world that you live in every day, right? Let me give you this example. When we go through high school and you take sex ed, we are taught exactly how not to get pregnant. We are taught how the process of pregnancy happens. We are told all about the male ejaculation. Never are we told about a female ejaculation. Never are we told about the clitoris. None of those things. We are never taught or even mention anything about feminine pleasure. None of that. And so as we grow older and time passes, we've carried that on. And so we don't talk about it. And so it becomes a generational thing where we're just not speaking about women's pleasure. Because even at the education level, it's not always talked about. Only recently was it put back into the anatomy books. And so that should tell you a lot about the female anatomy and how much it's been respected over the years.
How can one talk about displeasure if we're not even comfortable enough to talk about the pleasure?
Yeah,
you know, so
very much
that's
so.
interesting. So walk us through your process. So when a woman comes to you seeking assistance, seeking help, walk us through your process as to what that looks like.
Yeah, so the time most women come to me, they are quite frustrated because it takes about 3 to 8 years for women to come forward and to actually receive care for pelvic floor dysfunction, whether that be pelvic pain, painful intimacy, or leaking. Takes us quite some time. So what it looks like when it comes to me is not quite what most think because I am 100% virtual. So there is no exam, there is no vaginal exam or anything like that. But what it is I listen first. There's an intake process that you go through where I listen to your story. I understand what you've been experiencing. And then I go through of how I can actually help you resolve that. And the one thing about me is I will not tell you I can help you if I really can't. Because I don't want to waste any more of your time and energy that you've already put towards this.
How do you know when you can't help a woman?
If they have something that needs surgery, so if a woman comes to me and they need surgery, or if there are some red flags that I see, like for example, if I have someone that comes to me and as we're going through our sessions, they tell me that they're experiencing a huge bulge from their vaginal canal and it's really, really hanging out and they're having a lot of bleeding, then that's generally a red flag for me to go, you probably need to go see your primary care provider. If someone's having a lot of rectal bleeding and a lot of vaginal bleeding and they're not on their period, then that would indicate that you need to probably see a primary care physician. If you've lost a lot of unexpected weight, I'm probably going to send you to your primary care physician to maybe have some tests run to make sure that there aren't some other things going on. So those are the type of red flags that I would look for.
How does personal matters affect a woman's sexual health or her pelvic floor, such as, stress or, her day-to-day life? How does that affect her sexual life and pelvic floor?
Yeah, so stress and life experiences play a huge role in your nervous system. And so I will give you a very personal example. When my mother passed away, the grief that I dealt with, of course, she lived a good life. So I do miss her terribly, but she lived an extraordinary life. But when my mother passed, I dealt with constipation, a lot of low back pain. Intimacy between my husband and I was pretty non-existent. And my husband and I have an extraordinary sex life. So for my mother to pass and then time to also pass and me still not be able to engage in what I love with him, but also experience a lot of low back pain, a lot of leakage that I had not experienced before, was concerning. But I went to physician after physician and they all told me that everything looked normal, that nothing was wrong with me, that my leaking was related to me having 2 C-sections and 2 boys, that me not being able to engage in sex with my husband was now related to me just getting older in my body and my desire changing. And so that's really what caused me to look more into how the body worked, and why I went on to get my master's in education and physiology from Columbia, because I needed to really understand how the body handles stress and what it had to do with possibly what I was experiencing. So even though I was already in school, it was still quite concerning for me.
And what did you find? What did you discover?
Going through my own grief and going through physician after physician, no one ever really asked me how I was handling my mother's grief, how the trauma was impacting my body. And so I really took a step back and started trying to regulate my nervous system. I was in some pretty deep grief, and the trauma of losing my mother was huge for me. And it was just sitting in my pelvis. And that tension, that tightness that was being caused was causing my low back pain. It was causing me to have leaking. And that tightness was also not allowing me to engage in sex with my husband, because upon entry, it was like a huge stop sign. And it was because of the tension that was being held in my pelvic floor. So once I began to regulate my nervous system and really understand how that played a part in my pelvic floor, my back pain got better, my leaking slowly stopped, and I was able to get back in bed with my husband in a way that I hadn't since before my mother had passed. And that's why I treat the way I do, because I know how important it is.
So essentially, everything does start with the nervous system and getting that, I want to say, under control, for a lack of a better term.
So even think about when you get on the phone with someone and someone calls you and they say something that you don't like. Your jaw might tense up a little bit, your shoulders might tense up, and you're not relating that to your pelvic floor, but your pelvic floor and your oral cavity are connected. And so if you have a tight jaw, you will generally have a tight pelvic floor, or your pelvic floor could be tight because they are connected. And so what happens in your oral cavity happens in your pelvic floor.
So what are some steps women can start taking today to maintain or to have a healthy pelvic floor?
Breathing.
Breathe.
Breathing. So a lot of women, I like to tell my pregnant moms that when they give birth, they're not giving birth up here, right? Because you see women when they're going through labor, like if you watch some of the old movies, they're like, and it's like, well, the baby's not coming out up here. The baby's coming out down here, right? And so a lot of times when we breathe, we're not breathing from our diaphragm. We're breathing from up here. And so you really have to, the cue I like to give is, I want you to inhale as if you're blowing up a balloon. And then that's going to fill your belly. And as it fills your belly, it's going to lengthen your pelvic floor. And then when you exhale, you're going to exhale as if you're blowing through a straw. And that's going to allow your diaphragm, your belly, to recoil. Right. And so breathing is the number one thing that I like to teach, because a lot of us are not breathing in a way that is conducive to our pelvic floor. The second thing would be, stop listening to every time you hear Kegel on social media. Kegling can make your pelvic floor symptoms worse, because if you already have a tight pelvic floor and you are Kegling and you are constantly pulling up, then you are strengthening a tight pelvic floor, so you are making your symptoms worse.
That's interesting, because from what I understand about Kegels, apparently it's meant to make you, quote unquote, tighter. Is that what it's supposed to do? And that's why it could be doing the adverse thing that we would want in terms of the pelvic floor?
So it is making your pelvic floor stronger. So when he gets in there, you can suck him back in, right? But when you say tighter, I think of it being like tight, like something's never been in there. It is going to make it stronger. And it could feel tighter, but it's not going to necessarily make it where you feeling like a virgin all over again.
Yeah, because that is a misconception as well, right? That you're like the loose and the tightness of...
Yeah. I mean, it definitely helps, but it's not going to make you feel like a virgin all over again.
So if every woman could understand one thing about her body and her pelvic health, what would that be?
My top thing would be very aware of your own body and your own stress levels, because we as women do not realize how much stress that we are under every single day, because we stay in that heightened mode all the time, and we are never in that rest and digest where we allow ourselves to slow down and allow our nervous system to come down. And we just don't realize how important it is to take 5 or 10 minutes every day to breathe and regulate your nervous system. Sometimes that's just simply sitting on the couch and meditating quietly and doing some deep breaths. Sometimes it's just, hey, saying, I got to take some time for me. But managing your stress and understanding how that stress impacts your own body, I think, is the first thing.
So a lot of what we've talked about so far is about, sex and how the pelvic floor relates to sex. But I wonder, for the women who are abstinent or for the women who have never had sex, how does the pelvic floor relate to their overall health?
Well, it supports your pelvic floor organs. Again, that being your uterus, your bladder, and your rectum. And so maintaining good pelvic health, good pelvic floor health is still primary, regardless of whether you're abstinent or if you've never had sex. Because it does support your pelvic floor organs. We want to make sure that your bladder health as well, your rectal health as well. Even women who are abstinent or maybe even never had sex, that doesn't mean that they could not have pelvic floor dysfunction. A lot of times constipation can be related to pelvic floor dysfunction. Urinary incontinence can be related to pelvic floor function. So the pelvic floor is just not a sex machine, right? It's just not a sex muscle. It's way more than that. I talk about sex a lot because it is the one part of the pelvic floor that is generally missed.
Well, thank you, Dr. Hope. This was
welcome.
very special because honestly, when it comes to the pelvic floor, like I said earlier, it's something new that I'm learning about, truthfully. And I think many women can relate to feeling as though something is probably just wrong with them or just like the shame around it. So
There's a lot
thank
of
you.
shame. Yeah.
Yeah. So thank you for breaking that
Thank you
down
for
for
having
us.
me.
Absolutely. Is there anything that you want to leave the audience off with?
If you don't know, ask, because the worst thing you can do is not ask. Do not allow someone else to dismiss your pain. Do not allow anyone else to dismiss what you are experiencing. Your experiences are valid and they deserve to be heard. You have to be your own best advocate. If someone else is deciding to dismiss you, then you find someone else.
That's good.
Yeah.
That's good. Well, thank you, Dr. Hope. Where can the people follow you, or if they would like to work with you, where can women find you?
Yeah, so you can follow me on all socials at Hope for Your Pelvis. And then if you would like to work with me, you can go to hopeforyourpelvis.com.
Nice, nice. Well, thank you so much again, Dr. Hope,
Thank you. It was a
for
pleasure.
sparking the conversation around the pelvic floor. Again, my name was Meline Rose. If you enjoyed this conversation, please be sure to subscribe to Spark United on YouTube and follow us on Instagram. Thank you, and until next time, find your spark.